Hi guys, thanks for joining. Happy New Year. I hope you guys are all having a great new year. And welcome to the first episode of School Skin Series 2020. Dr. Henry just joined, so we'll have her join us so that we can get started. Be fun. Hi.
Hi, let me straighten this so I can see you here.
Yes.
Okay, there we go. That's a little
All
bit
right,
better. There we
perfect.
go. How are
Oh,
you?
good. How are you? Thanks so much. Nice to meet you.
Nice to meet you too.
All right, so we'll get started. I usually welcome everyone because
hmm
they send in all the questions and they are
hmm
here with us today on this beautiful Saturday, even though it's a little colder in New York. So, all right, guys. So I'm Dr. Kula. I'm a derm resident in New York, and I usually hold this session so we can answer all the questions that you guys usually have. And also, Happy New Year. Happy 2020. We made it. 2021. We made
Yes.
it. So joining me today is Dr. Henry. She is a world-renowned dermatologist and one of the best dermatologists we know. I'll let her give a
That's
quick
good.
introduction about herself and we get started to answer all the questions that you guys sent.
Excellent.
Go ahead,
Hi,
Dr.
everyone.
Henry.
Thank you for having me. So, I am a board certified dermatologist. I practice here in Manhattan and I do the full range of dermatology. So, everything from kids to adults. I do general dermatology, I do Mohs surgery, I do a lot of aesthetics. So, a large part of my practice is procedural. So, things like liposuction, Botox, fillers, lasers. So, I do a lot of that. And this is fun. You had some great questions. So, I'm excited to chat today.
All right, awesome. Yes, so you guys sent a lot of good questions. So I try to organize it so that we are not
Mhm.
all over the place. Since it's a new year, new you, and you guys sent a lot of questions about skincare routines, and one of the notorious one is the Korean skincare routine that I see it all over. A lot of my patients come in with it, and a lot of my patients do it. I just don't have the time to do it. So today we'll try to answer all your questions to see which one of those steps that you actually really need. So we'll have Dr. Henry answer the questions.
Yeah.
So all of you guys know it's usually about 10 steps. So of those 10 steps, Dr. Henry, which one of them do you think are necessary and which one do you think are a little bit superfluous?
So, I think that in order to have a good skincare regimen, you really only need 3 to 4 steps, maybe. So, you need to cleanse your skin, so a skin type appropriate cleanser. Treat your skin, so depending on whatever your skincare needs are. So, if it's hyperpigmentation, if it's just overall skin health, maybe an antioxidant, right? Moisturize your skin and then
Mm-hmm.
protect your skin with a sunscreen. So 10 steps are not necessary. However, if you enjoy them and it's a part of your self-care and it's a moment that you carve out for yourself and you enjoy it, then I'm a fan of it. But absolutely not necessary. You don't have to pressure yourself into believing you need 10 steps to have healthy skin. Not necessary, but if you enjoy it, then I applaud you.
No, 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 that's the same thing with me. So that's why even when my patient coming with him, my first question is like, do you actually have time to do all these steps? And if you do and it works for your skin, then go ahead. But like you said, like you just mentioned the necessary one that we actually need. And
Mhm.
some of those steps that a lot of the patient found confusing, which I actually wanted to know if you could clarify it, because some of the
Mhm.
steps, when you look at it, they also an, an essence and a serum. Is there a
Yes.
difference between the two or are they the same?
So yes, they are different. So an essence is has higher water content. So you might have active ingredients. So the point of an essence, a serum, all of those ingredients are to give your skin slightly more concentrated active ingredients than you'd get in, say, a moisturizer. What happens with a higher concentration is there's a slightly higher risk for irritation. So serum is going to be significantly more concentrated than an essence, which will have a higher water content. So if you're someone who has sensitive skin, you might go for an essence first before going for a serum. But that's the approach, is that an essence is going to be a little bit lower concentration, a little bit better tolerated than someone who's sensitive, but it's not going to give you as high of a concentration, and so it may not be as effective as a serum.
Okay, perfect.
Mhm.
Awesome. And the other part is just like a lot of my patients, when they come in, they
Mhm.
especially with the daily exfoliation part of the regimen, some
Mhm.
of the patients get irritation, but they don't understand that it's coming from that part. Do you think like you actually need to exfoliate exfoliate your skin every day, or is it something that you recommend like weekly or bi-weekly for your patients?
So it depends on your skin type and it depends on the mode of exfoliation. So if you are using a gentle chemical exfoliation or exfoliant, something like 2%, 3% glycolic acid, you absolutely can use that every day. That's safe and okay if your skin can tolerate it. Now, for someone who has sensitive skin, you absolutely cannot use a manual exfoliant every day or twice a day. That's going to be too harsh for you. So it depends on your A, your skin type, and B, the type of exfoliant that you use. I am a fan of exfoliating more frequently. So I would rather someone use a gentle exfoliant more frequently than a harsh one infrequently. I find that I get better results that way. So that's kind of my school of thought. So yes, it is safe to use it every day. It's just safe to use it twice a day, depending on your skin type. It's just about using the appropriate exfoliant.
Okay, no, that's great. So the other question is
Mm-hmm.
regarding the sheet mask, because when you see the instruction for the sheet mask,
Mm-hmm.
usually it says like you can't use it for more than 15 minutes to 20 minutes. And usually some of the question that I
Mm-hmm.
get, someone from the audience, they were wondering why can't they keep it on their face for more than 20 minutes when
Yeah.
it just feels so smooth.
Yeah. And so it depends on the ingredients. So sheet masks are different, right? So some of them are completely just hydrating. They have ingredients that we love, like hyaluronic acid. That's fine to leave on. Some of them have different active ingredients. So maybe they have an exfoliative ingredient or a sensitizing ingredient. So I would stick to whatever the recommended time use is because that's based on the formulation. However, if you were going to take a little bit of flexibility, you could take it with a completely hydrating mask, a mask that contains ingredients that we often leave on the skin. So we often leave hyaluronic acid on the skin. So things like that you can probably leave on until they completely dry. But if you're using something with active ingredients, I would stick to the recommended time frame.
Awesome, thank you. And someone from the audience just asked now,
Mm-hmm.
what manual exfoliation do you recommend?
So I am a fan of, sorry, my screen is so dark right now. I'm a fan of an old school sponge called the Buff Puff. I've probably used it since I was 11, and I'm still a fan of it. And if any of my patients are on here, they're probably using it too because I think it's fantastic. But it's a nice sponge. It has a nice weave that's tight enough that it doesn't damage the skin. That's loose enough that it doesn't damage the skin, rather, but tight enough that it gives you good exfoliation. So I love that. I love a Clarisonic. I do love, some of the more gentle, like I love a good sugar scrub. I love, depending on your skin type, will dictate how coarse of a scrub you can use. But I am a fan of manual exfoliation. But again, listen to your skin. If you have sensitive skin, it's not for you. But those are some of my favorites.
All right, perfect. So now we can move on to one of the steps that I'm also curious about is the eye
Mm-hmm.
cream because I don't use an eye cream, but I do
Mm-hmm.
recommend it for some of my patients for the more mature type as the
Mm-hmm.
skin get a little bit more mature. Do you
Yeah.
actually absolutely need it, or can you get away with not having it in your skincare routine?
So I think that you can get away with not having it to a point, right? Now, if you're someone who's starting to see those early
Mhm.
signs of aging, you're starting to see that you're getting some fine lines and wrinkles around the eyes. I do recommend them. Once upon a time, I used to just call them face creams in a small bottle. I used to think that they weren't necessary and it was just marketing. I don't believe that. I think now that, they are tested for safety around the eye. So I am a fan of them if you need them, but it's not an absolute must. If you had to pare down your skincare regimen to two or three things, it's not a must have. But I do think that if your focus is treating the eyes, then I do like them.
Yeah, perfect. No, it's like saying. So you brought up the Clarisonic, which
Hmm.
is like something that I've seen in the magazine. There's like pro for it,
Hmm.
some against it. And one of the viewers, they sent a question: are they really bad for your skin? So I guess maybe that's what the opinion that they have gotten the Clarisonic.
No, they're not bad for your skin. It's important that if you're using it, that you're maintaining it appropriately, that you're cleaning it appropriately, that you're discarding of it appropriately. It's not something you use for 2 years without cleaning appropriately, which some people do. So you want to make sure that you're maintaining it appropriately, that you're listening to your skin and you're making sure that you're not using it until your skin is raw or sensitive or things of that nature. But I am a fan of them. I do like manual exfoliation, but it's just about listening to your skin and not overdoing it.
What's your favorite device?
Oh, that's a good one. I like the Clarisonic. Proactive for a different price point. Oh, I don't think Clarisonic is around anymore, actually. Are they? I think they went off the market, right?
No,
You
I
can still
don't
get
think
these.
so. Yeah.
Yeah. Well, Proactive makes a good spin brush as well. Although Clarisonic kind of cornered the market, I think they patented their particular spin. So it's a little bit different. But Proactive makes a good spin brush as well. So that's another option.
Awesome, thank you. So another skincare ingredient that have gotten a lot of press
Mm-hmm.
lately, and is collagen supplement.
Hmm.
So someone wanted to know, do they really improve your skin like some of the news sources are saying?
So it's hard. There are some companies that claim that they do. If you look at their studies, they're usually paid for by the company. So I haven't seen any independent studies on oral collagen use. So I haven't seen any large scale studies that I completely trust yet. Maybe there is something on, that is packaged in a way. But when we think about consuming collagen, collagen is typically protein, some sort of protein, often marine protein. After your body has kind of digested it and distributed it all over the body, our organs, there's very little left for the skin. And there's very little way to concentrate it in the skin after you digest it. So if you were going to, and if you just have time and you enjoy the taste, by all means have it. It's safe, right? But can we absolutely guarantee it's going to the skin and improving your overall skin? Like, it's unlikely. But oftentimes they do
What
pack them with.
about the topical creams like?
Yeah,
Oh, go ahead.
topical.
Sorry.
I was gonna say, oftentimes in a lot of these collagen preparations, they pack them with other things that we do like. So, protein is good if you're someone who's protein deficient in some way, if you have a restrictive diet or things like that. But they may have vitamin C and vitamin D and other vitamins that we do enjoy. So oftentimes they're packaged with other things that are good for skin health. So I wouldn't poo-poo the entire category. But if that's the one thing you're holding on to for your skin aging or skin health, it may not be the holy grail. Topically, it's not the holy grail either. Those molecules are just too big to penetrate the skin. And so the big problem with skincare is just access. Can we get these molecules to where we want them to be? And collagen is just a big bulky molecule, so it's not going to penetrate to where we really want it. So creams that contain topical collagen aren't doing a lot.
Thank you. See, guys, there you have it. And I'm happy that we have the expert on here to answer all those questions, because you guys send it to me. I have to actually do the research. So the next question is something that I was not even aware of, that one of the followers asked. It's about something called Vetox. I was not aware of it. They brought up the questions. So they
Yeah.
wanted to know what is it, and it's actually better than Botox.
So Vetox is a brand. It's a brand. It was branded. What is most popular to me? So when you Google Vetox, all sorts of things, right? But the top few is actually a brand by an esthetician in the UK who's done a fantastic job of marketing this natural Botox alternative. And so it has neuropeptides, which, we have long conversations about peptides because peptides are actually ingredients I do believe in. We have long conversations about that, and algae has become a really popular ingredient as well. They're really nutrient rich. They're often really hydrating. And while all of these things are fantastic, it's no Botox. So I'm sure it will hydrate the skin well. Maybe it will stimulate a little bit of collagen because peptides have been shown to do that, but it's no Botox. So no, it is not better than Botox, but I'm sure it's a fine line and a fine brand, but it will not outcompete Botox.
Oh my God, awesome. So in keeping with that, another question that the viewers wanted to ask is regarding skin tox, which is like the Botox facial.
Mm-hmm.
Oh, sorry. Someone is asking, is it safe during pregnancy and breastfeeding as opposed to Botox? I guess they're asking about the Vetox.
Yeah, I'm not sure. I'd have to look through the full ingredient list to give you a good answer about that. Because although for the most part, skincare is safe, there are some ingredients that we don't want you using while you're pregnant. Things like retinol derivatives, and I'm not absolutely certain that it doesn't have that in there. So I'd have to take a peek at it. So maybe I could do that and get back to you guys.
Sounds good. Thank you.
Mm-hmm.
So skin tox, which is also known as the Botox facial,
Mm-hmm.
which there's a lot of like talk about using it to minimize pores, and also like for
Mm-hmm.
women who want the airbrush look especially like we use like all sort of filters to try to achieve that. What exactly is that facial and does it actually work?
Yeah, it does work. So it's something I do a lot. It's kind of like using Botox in the same way that we do mesotherapy. So if you guys know mesotherapy, that's like using little short needles and really injecting just into the mid portion of the skin, kind of the dermis. We call it intradermally.
Mhm.
And what it's doing is there is a little muscle there called your erector pili muscle. That's a muscle that gives us goosebumps. When we relax that muscle, it
Mhm.
also kind of smooths out the skin. And so, yeah, it does work. I do it a lot. I love it. I may do some today, actually. I'm a huge fan of it. So yeah,
Okay.
it does work. It's one of those
Oh,
things
that's
that when I do it for patients, they're kind of uniformly happy.
no, that sounds awesome. I think I should get it done too.
Hmm.
Um, so another question that I always get from my
Hmm.
patient, and somebody brought it up also one of the followers, that's regarding chemical sunscreen versus physical sunscreen for skin of
Hmm.
color patient.
Yeah.
Because the current thought is that physical sunscreens are the way to go no matter what. But then, like for skin of color, we're trading it for the aesthetic appeal because
Hmm.
you always no matter the brand, I personally haven't found like a physical blocker that does not give
Hmm.
me the slightest hint of like white. So
Yeah.
whereas I found like chemical sunscreen that I can wear it and I don't have anything at all. My pictures came out great. So when you go on vacation and you're thinking about sun protection,
Hmm.
so the patient, the followers wanted to know, is it okay for them to use chemical sunscreen um, if they are skin of color versus like just using the physical sunscreen because the datas are what they are.
Yeah. So now is a wonderful time to be alive for sunscreen. And as a person of color, we have so many different formulations. So we have some fantastic physical sunscreens that really look good on dark skin. Um, we have, so many different formulations, cream-based, powder-based, compact, pressed powder-based, physical sunscreens that look good. So CeraVe has a hydrating sunscreen at SPF that's great. Skin Better Science has their Tone Compact that's really great. That's also mineral. Color Science has a powder that's great, also 100% mineral. So, technology has gotten better, so we can micronize, we can tint these products, we can treat, treat sun care in the same ways that we treat skincare or makeup, find ways to mask that opaqueness of it to make it look quite elegant. So we have lots of options in terms of physical sunscreens, even for the darkest skin right now. That being said, I'm not opposed to chemical sunscreens. Historically, chemical sunscreens are more elegant.
Mm-hmm.
And some that I love, I like Supergroup Unseen. I like Neutrogena has a new invisible line that's quite nice as well. There's so many. When we avoid chemical sunscreens, we don't kind of bash the whole category of chemical. It's about teasing out those chemicals that have piqued our suspicion or our concern or our collective concern, even if we don't have the evidence of it. We're using it every day, and I feel like if there is something you're putting on your skin every day that you're concerned about, why, when you have other options, even if the evidence isn't there yet. And I think we've done that with sunscreen. So we've kind of extracted what they're calling O&O, octinoxate and oxybenzone. And so a lot of companies are already doing that for many reasons to give us a higher level of comfort with these
Mm-hmm.
chemical sunscreens. So you don't have to completely rule out some chemical sunscreens, just be a smart consumer and look for those with ingredients that make you comfortable. But if you do want to rule them out, there are lots of physical sunscreens that look beautiful on dark skin types. I personally use a physical sunscreen every day, and it doesn't look chalky on me. So I think many of us with dark skin will be okay.
Yeah, no, I
There's someone
completely
saying
agree.
this.
And
Sorry, there's someone asking a good question about rosemary oil and hair growth, and I love hair, so I can answer that one really quickly. Is that okay? Or maybe I'm seeing it and you're not seeing it. It's weird how this works sometimes. Uh-oh, I can't hear you. I think you're Yes, it can. So there are some. So I like this conversation because there's always a conversation I can see it. Can you
Me too.
guys, somebody can, if you can see us, can you heart? Okay, good. We're good. We're good.
Yeah.
So, rosemary oil is similar in some small case studies to 2% minoxidil. So that's fantastic. And I love that because it's something that I can give women who are pregnant, give women who are opposed to using, chemical treatments. So it is one of those topical treatments where we've seen on small studies some efficacy. Peppermint oil as well is another one. So if you're at home making your own natural hair solutions, that might be a good entryway. Now, if it's not helping you, don't wait because a lot of the reasons that we have hair loss can become worse and can become permanent. But if you want, always get evaluated by your dermatologist. But those are some natural ingredients that have some efficacy.
So speaking on that, so rosemary oil is an essential oil. Do you usually recommend that they dilute it in a carrier oil or just apply it as is?
Yeah, always dilute it so that you are at less risk of having any irritation.
Sounds good. Since now we're on the category of hair, another
Mm-hmm.
product that has gotten a lot of attention is biotin. And I
Mm-hmm.
feel like despite the evidence, a lot of patients still come in confused regarding its use and does it
Mm-hmm.
really work? What,
Uh-huh.
can you comment on biotin use for hair care, for hair growth?
So biotin is something we use a lot of, and in most hair vitamins, you'll see some level of biotin. However, studies on biotin are more for nails than for hair, and we kind of extrapolate from that data because nails and hair, they're kind of in the same system. It is something that I still recommend, but I do tell my patients that excessive biotin is not going to give you great, leaps and bounds in terms of your hair growth. So I no longer use excessive biotin for many reasons. But I think it can have some efficacy. It can cause acne in some people. But I do give my patients a full story when we start a treatment regimen with biotin.
Do you think there are a better alternative out there supplement for hair growth compared to biotin?
I mean, a lot of things that we commonly think of. Vitamin D, we know that a lot of people have vitamin D deficiency. So we want to make sure that you have vitamin D. We know that zinc, we know selenium, we know those sorts of ingredients that if you have deficits, there can be uh, they can contribute quite significantly to hair loss. So when I see my patients, I kind of do blood work and I check any metabolic, any nutritional, any autoimmune, any infectious reasons that they might have hair loss, and we look for all of those things. And if we see any of those deficits, we try to make sure we supplement for them. So yes, I am a fan of supplements, but I make sure that I'm not just shooting in the dark, and I try to address any real needs the patient might have because a lot of the ingredients that we use, those that are, well, vitamin D can have toxicity, but a lot of them, if you have excess, you just kind of urinate them out and they're not doing much. So I try not to kind of shoot in the dark and I try to make it really a science-based endeavor when I'm supplementing my patients.
Completely agreed. And someone just asked my next question: does Nutrafol works for hair growth?
I do like Nutrafol. Nutrafol is one of those that I like for many reasons. It has a lot of ingredients that are just good, right? So it has some biotin, not excessive levels of
Yeah,
vitamin. It has vitamin D, which I'm in New York. You're in New York, right? Yeah, you're in New York. Most of us here are a
yeah.
little bit vitamin D deficient on these short, dark days, right? So it's good to have a little bit of vitamin D there. And all of this, especially during this time, vitamin D supplementation is particularly important. It also has some other ingredients called adaptogens, based products that are ingredients that are good for us. And we actually notice in women with hair loss on biopsy, they tend to have more inflammation than men. So I use more anti-inflammatory techniques with women, especially, but with all patients. So I really do like Nutrafol. It's definitely one of my favorites. And I do recommend it to my patients.
Perfect. So awesome. And somebody else, Dr. Leon, wants to know, is there any value to using LED lights for hair growth?
I do. There are, again, small scale studies, but not large studies, that show that LED can increase the caliber of the hairs. So I do use it in the office and I do recommend it to patients. LED light can be, especially red light, can be anti-inflammatory. And so, again, we talked about stress and inflammation and the huge role it plays in hair loss. So I am a fan. It's not a standalone treatment, so it's not going to cure your hair loss by itself. But oftentimes when you have hair loss, there's so many different pathways. So I'm always just kind of throwing everything at you to get this under control, get it quiet, and get some hair growth. Um, so, um, so yeah, I do use it as a part of kind of a comprehensive hair loss plan.
Oh my God, they are killing us today. So somebody else wants to know about Viviscal.
I do. I like Viviscal as well. I would recommend Viviscal for a lot of patients. One thing to note is that Viviscal uses marine collagen. So if you're someone with like seafood allergy, you're not a good candidate for it. So if you're giving it to your patients, just make sure you always ask that. The cost is a little bit less, so it's nice to have an option that's a little bit friendlier on the pockets. So I do give that option to patients as well if they don't have marine allergy or seafood allergy.
No, sounds good. Thank you. All right. So, we
Mm-hmm.
covered all the hair growth questions that everyone sent in. So
Mm-hmm.
the other one, that other category is regarding hydroquinone use, and I always feel like as a resident, feel guilty because some of my patients usually come in already using it,
Yeah.
because they require it through other means,
Mm-hmm.
and I'm always addressing, oh, you shouldn't be using that, and then I prescribe it. So
Yes.
I feel like a little bit like a hypocrite, if you know what I mean.
Yeah.
So someone wanted to know, is it really that unsafe? Why do dermatologists always scream at me when I come in using it?
I do not think it's unsafe. Hydroquinone in lab rats that eat 3 to 4 times their body weight, they get cancer. So I tell my patients, if you're not going to eat 3 to 4 times your body weight, we're in a good place. We also don't want you to use it excessively because we know if we're using it excessively for months and months and months, you can get ochronosis, which is like paradoxically, you get darker. So you get darker instead of lighter. And part of why it has a bad reputation is because in many countries it's been adulterated and used with other ingredients like mercury, which is a cheap way to lighten the skin, but we know is very toxic. Corticosteroids, which also can be inexpensive ways to lighten the skin, that can also damage the skin, and that's when we see patients coming in with prominent blood vessels and those kind of like odd orangey skin color and thin skin and things of that nature. So because it's been adulterated throughout the world, it holds a negative reputation. I think when used appropriately under appropriate dermatologist guidance for a few months, it's one of the strongest tools we have in our toolkit, and I do use it, but in that way for a limited period of time with appropriate guidance. I make sure no one's eating it, and we usually do
Yeah.
pretty well. So I think with all things, poison is in the dose, right? Many things can become
Yeah.
poisonous if used in the wrong dose, and I think hydroquinone sits in that category.
That sounds good. So another thing is, because a lot of patients they use facial wipes, and now with the invention of
Hmm.
micellar water, this is like the next new thing, like in skincare.
Hmm.
So someone wanted to know what is the difference between the two, because they are saying that facial wipes, you shouldn't put that on your face.
Yeah. So I mean, it's so funny. All these categories kind of just marry each other. So now you could have you have micellar facial wipes now. You have,
Yeah.
non-toxic, reusable facial wipes. We're talking about just like traditional old school categories. Facial wipes tend to have higher alcohol content than micellar water. Micellar water, which was initially sold as being like a pure way to clean your skin, close to pure water itself, still has surfactants in it, so it's still a cleanser. And there are surfactants also in facial wipes. So with both of them, I recommend washing your face afterwards if you can, at least rinsing it, because there are going to be surfactants there that can be a little bit irritating. If I had to pick between the two, I would say that the micellar water is going to be less sensitizing than the facial wipes. So if you're particularly sensitive, I recommend using the micellar water. The problem with micellar water is that it's not going to be as great at getting off all of your makeup. So maybe reserve your makeup wipes for when you have a full face of makeup. But micellar water is something you could use more frequently. Both of them, you should do a little splash of water after you use them anyway.
Yes. No, no, well said.
Yeah,
Thank you.
you're
So
welcome.
cellulites now, I hate them because I have them, and as a
Which one?
dermatologist resident, I know
I
there's
missed
like
it.
limited cellulite. Cellulites.
Cellulite. Oh, yes. Yes,
Yes.
cellulite.
So yeah, so I hate them. I have them, and it's a struggle.
Hmm.
Someone I wanted to know about bio oil. Does it really work? Because they've seen a lot of
Hmm.
papers, magazine. I'm talking about it.
Unfortunately, no, it does not work for cellulite. It works to moisturize the skin. Bio oil is essentially mineral oil with some other plant-based oils. So it's quite popular, especially outside of the States. It's really popular. People tout that it can do everything from like prevent belly stretch marks, and jury's still out on that if hydration plays a huge role. But it's more of a hydrating ointment, you know, I guess healing because it keeps the skin in a well hydrated state. But it's not going to help with cellulite. You know, cellulite is a combination of kind of genetics and kind of the lymphatic system in that area and the structure of your skin. It's a complex thing that a cream alone is not going to help in any meaningful way. But there is a new good treatment called, I don't know if you've heard of it, called Quo, which is a collagenase. It's the first kind of injectable treatment for cellulite, which I'm thrilled about because I've been treating cellulite for a long time. And prior to this, we either had, you know, I've used things like Sculptra to fill in, you know, kind of broad-based divots, or I used to use something called cellulase, which was like more of a laser. And then there was Sulfina, where we had to insert a blade to break it up. But the problem with brown skin is if you insert a blade, you get hyperpigmentation. So you're trading one thing for another. But now Quo, we can inject those little cellulitic lesions and get improvement. So bio oil does not work, but we have some real options now that's safe for all skin types. So again, it's another good thing.
No, that's amazing. I need to try that treatment because I need it. So so someone wanted to know about using bio oil in pregnancy because you mentioned it, the fact that some people mentioned that it can be used for stress removal even though it may not work.
Yeah.
Because it does contain retinol palmitate. Is it safe in pregnancy?
You know, I am hyper conservative, and these are all, it's a theoretical risk. So I'm more often going to say no. You know, the major ingredient, the major ingredient in bio oil is mineral oil, and if you want to use that, you can get that in Vaseline, you can get that in Aquaphor. So maybe I'll use one of those. You know, I'd have to do an exhaustive list. If you ask any of my patients, I am an aggressive label reader, and I will have them bring in every single product and aggressively read through every label. So it's rare that I give just a haphazard yes. So without knowing all of the ingredients, it's hard for me. But any kind of retinol derivative, I usually stay away from.
Perfect. So this takes us to the last topic. It's
Hmm.
on mineral oil because there's a lot out there on it. What is your take on mineral oil? Is it good or bad for the skin? Is it
Hmm.
comedogenic? Is it something that you wouldn't recommend? 'Cause there's a lot out there on it.
Yeah, so mineral oil gets a bad reputation, so they kind of keep it out of like clean products because it's a derivative
Mhm.
of petrolatum, which is a derivative of crude oil. But crude oil, of course,
Yes.
is toxic. We've seen all the spills everywhere. I'm from Houston, so I'm quite familiar with crude oil and its toxicity. But this is super refined, and so it's so refined that it should not have any of those contaminants, but it still has a bad reputation. It is super occlusive, so it's good for locking in moisture. So it's good for those with really dry skin, which is why you see it in things like Aquaphor, which we use on babies, right? However, although it is not
Mhm.
comedogenic itself, so like studies don't show that it will clog the pores, it is so occlusive. So occlusive meaning it sits on top of the skin and just like locks everything in. So if it's sitting on top of something that is comedogenic, it's going to lock that in too. So it's going to cause, although it itself isn't clogging the pores, it can encourage other things to clog the pores, if that makes sense. So I am not afraid of it, but if someone is super acne prone, I might stay away from it because it's going to kind of lock in your other oils and cause you to have more acne. Although itself in human studies, it doesn't show that it's comedogenic. I don't know. Does that answer the question? Or is that a
No, that answered
roundabout way?
no, no, it no, it answered it really well. What about coconut oil for your face? Because a lot of my patients come in using it.
Yeah, I know. I always get people always write on my social media, I don't do Botox, I only use coconut oil. And then in the back of my mind, I'm thinking, we'll treat your acne later. But so it does clog your pores. It is one of the more comedogenic oils. So I like coconut oil below the neck, I mean below the face and like above the forehead. So you can put it in the hair, that's completely fine. You can put it on the body. It's actually slightly antimicrobial, so actually kind of good for eczema. So you can put it on the body. On the face, it can clog your pores. So for those of us who are wed to coconut oil, see, I saw your flag. You're Caribbean too, right? Are you Caribbean?
Yes,
Yeah, so my family's
I'm from
Grenadian.
Haiti.
Yeah, my family's Grenadian,
Yeah.
and we have a rich coconut oil in all things coconut culture. So I cannot, it would be blasphemous for me to poo-poo coconuts. But on the face, it's a no-no. On the body, you can put it on the body, on the hair, you can drink it, you can eat it, whatever you like. Just keep it off of the face. No coconut oil on the face.
Sounds good. So we have time for a few more questions. Someone
Yeah.
wanted to know, what products do you recommend to prevent stretch marks?
Oh, that's a hard one, you know. There's nothing that's excellent, and all of the ingredients that we use afterwards to treat stretch marks, some of the better ones, which are retinols, I don't like you to use on while you're pregnant. So all I can really recommend is just, moisturization. Will it do it? I'm not, it's hard. That's a hard place. I wish if I had a magic remedy, we'd come up together, we'd come up with a we'd retire, right? Because there's really nothing out there that has been proven in any meaningful way to prevent stretch marks. So, healthy weight gain during pregnancy and moisturizing as best as you can.
All right, so we have two questions on the question box. Someone wants to know, zip lines and genetic discoloration under the eyes. Will under eye filler resolve only the lines or both?
So it's hard, lines, one person's line is one person's fold is one person's, so line is something that sometimes we have to I have to assess visually. So if it is a kind of a sunken area, a sunken line, filler will fix that. If they are lines that are kind of like just redundant tissue, like redundant skin folding on itself, sometimes nothing will fix it by cutting it off. If they're little fine lines, and sometimes Botox will help. If they're fine lines, sometimes creams can temporarily help. So it's a combination of, we'd have to see you to see what's going on there, but anything from fillers to Botox to blepharoplasty is the surgery we do where we snip out any like excess skin. So we'd have to see it to see what the best treatment is, but most of the time we can find something that works for you.
Sounds good. Okay, so we'll end with this final question, which I think is actually pretty fit for the new year, new me, because I feel like a lot of you guys have been asking a lot of questions regarding skin regimen because you actually want to start having one. So this question says, what is the sequence for a good facial regimen?
Yeah, so the sequence is, and it doesn't matter if you're doing 10 steps or 2 steps, the sequence is thinnest to thickest. So the absolute thinnest is going to be your cleanser. And then next would be like a toner, or if you're using these things again, okay? But it's going to be a cleanser, then your toner, then your essence, then your serum, then your moisturizer, then whatever is next. So it's always the thinnest in terms of like texture and weightiness to the thickest.
All right, awesome. Thank you so much. And thank you
You're
guys.
welcome.
Let's give Dr. Henry a lot of hearts for taking the time today to answer all the
Of
questions
course.
that you guys sent me. I had a lot of fun and I learned a lot, especially about the rosemary oil. I didn't know that as an option for my patient when they come in asking for hair loss. So I'll definitely add that to my
Yeah.
regimen
Yeah.
to tell them. So thank you so much.
Of course, it's
It's always a
it's not,
pleasure.
of course, not more powerful than what we do, but for those resistant patients, of course, you can offer it to them.
Yes.
Okay?
Sounds good. Thank you so much. All right, guys. I'll see
You're
you back. So we'll do this once a month. So I'll announce the next speaker soon. It's always a pleasure, and thanks so much for sending all the questions. And have a good rest of your week. And thank you so much, Dr. Henry. It's such a pleasure.
Bye. Thank you. Happy
Bye.
Sunday.
Thank you.
Bye.
Bye. Happy Sunday and Happy New Year, guys. Bye.